Now, right, you are somebody who has seen different side of me.
I'm very honoured.
Adulting with NOC.
Hey babes, today we're at a medical center because Aiken is getting down and dirty with a female doctor.
By that, she means that we are actually going for 2 medical procedures. Mine is a colonoscopy where they will basically put a scope up my and see the insides of my colon. And Sylvia, you are going for a
Mammogram, which is a hot favorite among ladies of Singapore. And I'm very kiasu, so I want to be here for a quick preview lah.
Right. So 45% of you said you've never actually done a medical screening. So today, right, we're going to give you a first-hand look into these experiences.
What I really want to do today is actually go through the whole experience and tell you guys what I feel after lah.
That's right. And as you all know, prevention is better than cure. And also, if you detect something early, higher chance to save your life. So let's go.
Let's go.
I decided to go for my colonoscopy because I've been facing some irregularities down there. So Dr. Hsien, what do you do as a colorectal surgeon?
As a colorectal surgeon, we diagnose diseases related to the colon, rectum, and anus. We're able to provide a variety of surgical procedures to treat some of these colorectal diseases.
So Dr. Hsien, I've thought about this long and hard. Does it take guts to be a colorectal surgeon?
I would say you need some brains, heart in the right place, appropriate amount of guts, as well as a decent pair of hands to be a colorectal surgeon.
Wow, that was very inspiring. Are most of your patients male or female?
I have an equal number of male and female patients because colorectal diseases are equally prevalent in the male and females.
But does this mean, right, that you have to look at your patients' buttholes?
Looking at the patient's butthole is part and parcel of a colorectal surgeon's job.
Yes. Apparently, colorectal cancer is quite common, is that right?
Colorectal cancer is the top cancer among males and the second most common cancer among females above 50 years old.
Okay, so let's talk about the colonoscopy. What's this procedure like and what do I have to go through?
It is a flexible scope that we put through your anus. So prior to the procedure, you need a bowel preparation to be done.
Oh yeah, done.
So after the bowel preparation, the patient will check into the scope room, receive the moderate sedation, then we'll introduce the flexible scope through the anus and maneuver it through your rectum and colon to have a good look.
And how painful would you say this procedure is for the patient?
Well, with appropriate amount of sedation, patients are very comfortable. And in fact, a good proportion of patients doesn't even remember what has happened.
Oh, great. I'm very assured. I'd rather not know. What age would you say is safe that people should start checking their colon?
Our national guidelines actually state that people above 50 should go for screening. But the emerging data that colorectal cancer is happening in younger patients as well, we should consider screening earlier at 45 years old.
Yeah, 45 is great, but so is 32. Dr. Hsien, what leads to higher risk of colorectal cancer?
Modifiable factors are factors that you can change, including your eating habits.
That one a bit debatable because it's my job.
Also something to do with your lifestyle.
Okay.
If you can exercise more and stay active, that would be great. As well, people should stop smoking if possible and limit your alcohol intake.
Okay.
Alright. The non-modifiable factors are factors that we have to live with, including like your age. If you have got a personal history or family history of polyps or cancers, and patients who have got genetic syndromes such as FAP or Lin syndrome is at very high risk of developing colorectal cancer.
So Dr. Hsien, when do I know that I need to go for a colonoscopy?
Just like what you are doing today, you feel that something is not quite right with your guts, it's good to come forward for evaluation. If you're above 50, even though you have got no symptoms, it's ideal to come forward for screening as well.
Will the colonoscopy, right, have any bleeding?
Doing a diagnostic scope should not cause you bleeding. However, if we find a pathology in the colon or rectum and we need to do biopsies or removal of polyps, then there is a small risk of bleeding associated with the procedure.
Thank you, doctor. I really appreciate it, and now I feel a bit more assured going into this.
Okay, so I'm here with Dr. Tan, a breast and thyroid surgeon, and it's my first time doing a mammogram, so I got a few questions to ask you. Okay, doctor, are you ready?
Yes.
Okay. What does a breast surgeon do?
As a breast surgeon, we tend to see a lot of patients with quite concern about breast cancer. So they come and see us worried with certain symptoms that they have, or patients with having a scan that looks abnormal.
Are all your patients female? Do you even get males?
So most patients who come and see me for breast problem are women, but there are some guys who come and see me as well, and they usually come and see me because they have either a lump in their breast or some symptom in their breast. About 1% of all patients diagnosed with breast cancer are men.
So doctor, in the event of breast cancer, okay, must the woman actually remove their whole breast?
The simple answer is no. Most women will have a choice. The decision of that is based on the size of the tumor, where the tumor is and what it involves. The two choices are either to remove half the breast, which is a lumpectomy, or remove the entire breast, which is a mastectomy. The outcome in terms of whether the cancer comes back is exactly the same.
How common is breast cancer?
So unfortunately, breast cancer is not uncommon. About 1 in 13 to 1 in 15 women in Singapore will develop breast cancer in their lifetime.
That means in my office, right, actually potentially 3 of us will get ready.
That's why mammogram is important.
Yeah! So you mentioned mammogram, right? So what is it really and what's the procedure like?
So mammogram is an X-ray of the breast, taken at 2 different angles. During the procedure, what will happen is that a technician will put a woman's breast on 2 plates and they gently compress it and then take an X-ray. And the purpose of it is to look for any abnormalities within the breast itself, best before any symptoms appear, so we can catch the cancer early.
So at what age should people actually go for a mammogram screening?
In Singapore, our guidelines advise us that all women aged 40 and above should get yearly screening, and above 50 should get once every 2 years.
So I'm being very careful today because I'm young but I'm still doing.
Yes.
What will lead to a higher risk for breast cancer?
The 4 most important risks for breast cancer is age. The older you get, the more likely you're going to get it. Gender, so women are more likely than men. Breast density and family history. But there are also things that you can change. For example, not smoking, reducing alcohol consumption, maintaining a good weight. We know obesity is related to breast cancer.
When should I actually go for a screening? Like when I feel a lump or what?
So screening means that you go and check before there were any symptoms. By the time woman feels that there's a lump in the breast, then they definitely urgently need to see a doctor because there's already symptoms.
And the final question, our audience think that it's going to be a very painful procedure. How painful is it?
So most women do tell me that they have a little bit of discomfort during the mammogram. What I usually advise them is that to go to get the mammogram done about 10 days after the start of the period, because that's the time when the breast is least swollen and least tender. Some women who have bad experiences with mammogram, I also tell them to take 2 Panadol before they go, so that it's at least a bit of a pain relief.
Is it? Like, do people actually scream in the room or what?
No, they don't. When they compress the thing, it's actually quite gentle. It's normal to have a little bit of discomfort.
Okay, thank you, doctor, for all your answers. I think I've got everything that I need to know.
So it is the night before, and you're supposed to fast from 6 p.m, which is no problemo, and then you have to do something called bowel prep. Okay, so right now, all I'm gonna do is make my bowel prep, which is 4 sachets, 4 liters, 1 every hour, and it's time to shit. Everybody, it is like the 5th time that I'm on my toilet bowl, and I do not mean to be explicit. I will only show you up to here. But basically, it's churning and then like flush it out. Churning and then like flush it out, right? So the goal is to get a clear colored dispelment so that you know that the insides are clear. Okay, that's all I want to tell you.
Hey babes, tomorrow I'll be going for my first mammogram and I'll be showing y'all the prep work, which I think is very important. According to my very analytical mind, I think the bra matters when you go for a mammogram. It cannot be a sports bra because it's a bit like tight and then hard to take out. So it must be those like that can open from the front or the back one. Yeah, so that's the first tip. Just like I prep for my COVID vaccination, I'll be prepping for my mammogram by outfits. Okay, I'll be wearing this. This is my favorite skirt. Why? To cheer myself up. And then I will pair it with a black top because it's a bit sexy. That's why. Okay, I'm done with the outfit choice. The most important prep book of them all is, I feel, to tell your best friend you're going for this experience, okay? AGM, mommy is going to mammogram tomorrow. I'm so scared. Okay, I feel better now.
Hello?
Hello, is
Liana
this Liana from
IPP,
IPP?
right? First things first, I'm going for a mammogram.
I'm calling because I'm actually going for a colonoscopy.
Hospital bills are quite expensive, right? How do I proceed?
Is it claimable?
Will I be able to
if,
claim
let's say,
if I am diagnosed with anything?
Oh, don't worry. You have an existing HNS plan. In the event of a procedure or surgery,
Okay.
you may be able to claim from your hospital and surgical bill. And not only that, if you are having an early stage critical illness condition, you will also be covered from your existing insurance plan. Remember, after your checkup, please update me if you are in perfect health, because your existing life insurance gives you a discount if you're healthy.
Oh wow, I get a discount if I'm healthy. Very good. That's a relief to hear.
Oh, is that right?
Yeah, have a great checkup, stay safe and healthy.
Okay, then I'll let you know of the results.
Bye-bye.
Cool.
Okay,
Thank
great.
you so much.
I'll do
Thanks.
that.
Bye-bye. Hello everybody, so it's D-Day. So after passing out my past life and present, my stomach's quite flat. I'm laughing and all, but I'm terrified.
Okay, I've been given the robe and the changing room is right behind me. I'm gonna be going in.
I'm gonna give you a room tour! Okay, honestly, I'm feeling quite nervous. That's why I just wanna, take my mind off it. But welcome to the room. We have got a very small bed here. Oh, there's even a safe. And then let me show you the gown. It's bareback. This will be very exposing.
Review of this changing room is it's a changing room lah, like it's a small room like this, and then got some like okay, standard. I'll change and see how I look. I gotta say, this is not exactly the most flattering gown. If Aiken gets a better gown than this, I'm gonna be quite upset. But okay lah, can.
I'm having such a hard time with this gown. I feel like I'm living in those biblical times. It's actually a bit bareback. Dr. Sim, correct or not?
I only know how to do the scope, don't know whether the budget is correct.
Alright, this is the room. Let's see how. Oh wow, got designed the. Oh wow, the room looks like a female spa. What service do you provide? IPL, facial?
So nervous. I just want them to come and get it over with now.
This is it, right? The machine.
Yes, this is the machine itself.
Right. Oh, it's also like nice and like white and pink. Okay, it doesn't look that bad.
This is so nerve-wracking. This is where the scope will be done.
I need to verify first your details. What is your IC number and your name? Right after that, we have to go through with some screening questionnaires.
Alright, so the questionnaire looks like this. Very easy to answer.
Our important question, Dr. Sim. Because I saw the scopes here, right? I'm just curious, is it the left one or the right one?
Your colon is pretty long, it's at least about 1 meter to 1.5 meters. So it is the scopes on the left side.
Oh guys, it's the scope on the left side!
To explain the procedure first. So for the mammogram, usually we do a basic picture, 4 images, which presses your breast 4 times,
Okay.
front and then a side view. So what will happen, basically, we just put your breast on this compression paddle, and then we do some compression. Alright,
Wow.
so this plastic compression paddle will go down to your breast and do some compression. Turn the machines toward the side, doing a side view picture.
Wow.
Which we do the same thing, putting your breast and you do some compression. That's it after that.
Okay, how long is this whole thing gonna take?
Around 10 to 15 minutes.
Oh wow. Okay, looks very atas. I think I'm ready to go. So I am standing the whole time, right?
Yes.
Okay, so
It's too much pain for you. I can do some
right.
adjustment.
So I want
on the machine.
like
We're not going to press it until you cannot tolerate it and all.
I'm feeling really great. I'm not sure how Aiken feels. So I have to off the camera now because the X-ray is gonna start.
Dr. Sim, how long will this procedure take?
Well, generally the colonoscopy will take about 20 to 40 minutes, really depend on what we find on the scope. If there are many polyps that needs to be removed at the same setting, it may take longer.
Okay, I think don't have, so never mind. Alright guys, this is where I'm going to be mildly sedated and I'm going to take a nap. I will see y'all after this. Wish me luck.
Okay, bye Joel. Thank you. Thank you. Oh my gosh, I'm actually done. So this is actually a super fast process. And I want to say, I feel this is a bit anticlimactic. So I think y'all built me up like, oh, this is so painful, this is so scary. But like now that I'm in it and I've just done it, I actually feel that it's quite an easy process. It wasn't painful, it was just discomfort. So I think the conclusion here is I'm very brave and I'm ready to see the doctor. Okay, bye. Okay, I'm just done with my mammogram. So when will I get my result?
After 2 or 3 hours, the result will be out and you'll see a doctor will get the result.
So what are the possible outcomes I will get from my result?
So most patients after the scan will have all clear. Only 0.5% of patients who go for scans will have breast cancer. Sometimes they find an abnormality within the scan and they will ask you to go get further testing such as a biopsy or more scans.
So if in the unfortunate event somebody gets breast cancer, right, what are the treatment choices?
So the treatment will depend a lot on the size of the cancer, the stage, and what symptoms the patient is actually experiencing at that time.
Okay.
It usually involves a combination of surgery, chemotherapy, and or radiotherapy. If the cancer is caught early, so for early breast cancer, it's completely treatable, and most patients will live completely normal lives after the treatment. And the second thing is that if it's caught early as well, the treatment may be simpler, so you may not even need chemotherapy.
Ah, okay, that's a relief to know.
It's good that you're getting your mammogram today. October is Breast Cancer Awareness Month. I think it's important for us to spread the awareness as well, because it's important to let your mother, sister, aunties all know about this so they can get screened as well.
Okay, thank you, doctor. I learned a lot today and I'm going to go get my results.
Okay, so everybody, I am done. To be honest, it just felt like a very, very shook nap. I know you're gonna ask if down there feels like weird, but really don't really feel much. So I'm just gonna go and check out my results now. I hope everything is okay.
How was the experience?
To be honest, I don't really remember much. I just like knocked out, I had a really good sleep. But I feel that now you are somebody who has seen a different side of me.
I'm very honored.
Because I know most people see me on screen, right? I think you see me on screen but in a different way.
I see the insides of you.
You did. So I wanted to ask, do I have to wait for the results or are they already ready?
Yeah, they're ready. Do you want to know?
Yes.
Your results are good.
Oh, even with all the eating.
You are very lucky. So there is no inflammation, no ulcers, no polyps or cancers that we found during the scope. So
Okay.
I would say it's good news for you.
Okay, so since mine is normal, right? I'm curious, what would an abnormal finding look like?
It can be in the form of infection, inflammation, ischemia related to poor blood supply, or in the form of polyps and cancers. A polyp essentially can come in different forms, shapes and sizes. The diagram that I'm demonstrating is a polyp with a stalk. And these are polyps that are precancerous. If they're not removed, they can actually turn into cancer over years.
Oh, okay.
If it turns out to be colorectal cancer, it will turn out to be quite a nasty looking growth with abnormal looking vessels and the linings is completely irregular. We have to take biopsies to confirm the presence of cancerous cells in that lesion.
If let's say it was found that I have colorectal cancer, what are some of the treatment options available?
The treatment options for colorectal cancer is largely surgery. We know that surgery is the mainstay of treatment for most colorectal cancers.
Okay.
There are adjuncts such as chemotherapy and radiotherapy, but really these are for advanced cancers and for selected cases.
Right. Thank you so much, Dr. Hsien, for sharing today. I'm very pleased. I've learned a lot and I'm also thankful that I'm in the clear. Okay, so we are done. How was it for you, Sylvia?
It was very good. It was like a spa. I enjoyed myself.
A spa?
Yeah.
Yeah, same. Just kidding. No, mine had like the scopes hanging down, like tentacles like that, you know.
Oh, wow.
Yeah, and that was the last thing I saw before I knocked out.
Alright, like
But-
total recall.
But after I knocked out, right, it just felt like I woke up from a nap. Yeah.
Right, so are you?
I am, as I would quote Dr. Sim, she said, I am clear.
Right. okay.
All is looking well. How about yourself?
I'm rather cancer-free lah.
That's great news.
Yes, there's a real reason why I'm doing a mammogram today. So I have a godma and she passed away when she's in her like early 50s. Okay, and it's because of breast cancer. She felt a lump in her breast for a long time.
Yeah.
So she let it be for at least like 2 years
Oh no.
before she had the courage to go and do a mammogram.
Right.
And by the time she went for the mammogram, it was already like terminal.
Yeah.
Right, so because of that, okay, a firm believer of early detection saving lives.
Maybe you're watching at home and you are deciding, yes, now is the time for me to go for a medical screening. Well, not just our procedures today, right? But you can sign up with SOG and they've got a group of specialists under their care, anything from pediatrics to ONG. And from start to finish, they'll make sure that you are well taken care of.
And a little bonus for you, if you arrange a non-obligatory meeting with one of the advisors at IPP Financial Advisers, you can get a wellness goodie bag from us.
Call Liana. She will help you.
You calling Liana again, is it?
Yes, I am. She settled all my stuff.
Oh. That's all we want to share. Hope you learned something because we kind of had fun. For me, I think I had fun.
I wouldn't use the word fun, but I'm glad I came out clean with a great report.
All right. Stay safe, everyone.
Bye-bye.
Adulting with NOC.
Is it like patient etiquette to like maybe groom and clean a little bit down there before we come and see you?
Wow. It would be nice if you can groom the area before coming to see me.
Oh, okay. So like waxing or what lah?
No lah, waxing is overdue.
Okay.
So generally just keep the area clean will be
Sufficient.
ideal. Yes.
Okay, got it.